Hi everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, today we're going to talk about little babies vomiting, reflux. So this is quite a common problem with kids. You know, all little babies, they're going to spit up from time to time, and that could be because they're eating too fast or, get excess of air in the bottle. So those will tend to do that as well. And then also if they move afterwards, they're feeding, they move excessively, they're rolling around playing and stuff. Obviously that'll happen with kids too, but especially with babies. But hey, what if they're still doing this? You burp them okay, they're eating slow. What happens if they're still going on? Well, there's some things to look at. Obviously their formula. Now I see a lot of issues, and I see a lot more nowadays where baby having sensitivity to the different types of formulas they eat. Could be that they're not able to digest it as well, so they'll spit it up after that. And what often they'll do is they'll give Xanax, and Xanax is a drug that is used for adults. I don't think it's ever approved for baby use, but it's used for adults to prevent acid reflux or heartburn. And that's exactly what it'll turn into later on when, if and allowed, that baby is allowed to keep progressing the way it is. Now, they might outgrow it, so to say, but it starts to catch up with them later on. That could be a possibility too. So one of the best things that I would always encourage, if you're not doing this already, if you're pregnant, you're having a child, or thinking about having a child, breastfeeding is the best way to provide nourishment for your baby if you are able to do that. Some moms can't do that, and I don't want to make them feel bad in any way. It's just they're not able to do that. So for whatever reasons, maybe they had surgery or other things as well. But breast milk is definitely the best way to go. If not, goat's milk is a safe alternative too. The proteins are smaller, they're easier to digest, and that's some way that you can do that. Now, if you're switching the formula up, hey, I don't want to put my child on Xanax, that's an issue. And hey, I know that it's getting slow and you're not getting enough air. We have to ask the question why. Why is this child having a problem spitting up? And one of the answers is you have to look at the nerve supply. You have to look at, hey, is the stomach upset because of the nerves? Now, we know that you get jittery, you get nervous, the stomach will get upset, and that's your emotions causing your stomach to get upset and queasy, right? We've had that before. So it's no different for babies. And I'm not saying they're getting nervous or anxious. I'm just saying, hey, the nerve supply that's controlling the stomach, we might need to look at that. And that's what I do as a chiropractor is, hey, let's ask the question maybe where the nerve is a problem, particularly the nerve coming from the neck all the way down here that talks to the stomach. That'll have an effect on how the baby's stomach is moving actually. So if you do have any questions, try those tips out. But if you do have any questions at all, I'd be happy to help you in any way. And maybe a brief consultation will help clear some issues up, and maybe to see if chiropractic may be the right fit for you and your baby. I want you to have a wonderful day. If this was great for you, pass it on to somebody that may need it. And take care. Have a wonderful day.